We're having technical issues, so just hang on a sec. Good morning. Sorry about that. We were having problems with YouTube being connected, and we're okay now. Welcome, everyone, to the Committee of the Whole meeting of Tuesday, March 4th, 2025. Just a reminder that this is a Committee of the Whole meeting, and no decisions will be made here today. There will only be recommendations that will go to our next regular council meeting on Tuesday, March 18th, 2025 for consideration. A couple of reminders for today's meeting. Members of the media may sit in the upper balcony at the reserved media table. All other guests, please take a seat in the first floor gallery. If that is full, there is overflow seating on the second floor in the Victoria Room, where you will be able to see and hear the meeting. We live stream the meeting on our YouTube channel, and the recording is available after the meeting. This meeting is also broadcast on Broadcast Live on your TV, Cogeco Subscribers Channel 10, HD Channel 700, and rebroadcasted on Wednesday at 9 a.m. and on Saturday at noon. Because meetings are accessible to the public in all these ways, video or audio recordings by members of the public is not permitted in council chambers. This is to ensure that all attendees and those who come to make a deputation feel at ease. Thank you for your cooperation. Can I get a motion for the adoption of the agenda? Deputy Mayor McDonald, Councillor Richardson, all in favor? And that's passed. Are there any disclosures of pecuniary interest on anything on today's agenda? Seeing none, if any arise during the course of the meeting, advise the chair and we'll deal with it accordingly. Moving on to deputations. Our first deputation is an analysis of the ticketing data from customer service for the city of Kawartha Lakes. We have Mr. David Webb. Mr. Webb, you have 5 minutes.
All right, thank you. I'll get right into it then. So I bring good news. And as an awareness for council, and to keep service excellence kind of on the high priority list, I did an analysis of reported tickets using data from last year and done a comparison to an analysis I did the year before. The full analysis was provided to the CAO and customer service manager in January. My observations: good news, improvements. So the number of cases in tickets went down by 3%. Not sure why that is, but the average time to resolve went down by 5%. So from 37 days down to 35 days. And I guess the only way I can explain that is I think service excellence actions that the city has taken are working. So keep up the good work. I do have to report, though, that communication back to incident reporters is at best inconsistent. And with the data I had, it's uncertain whether the actions taken to close tickets always resolve the issues. The next page, the analysis summary. So at a high level, we've got by department, some improvements and some that aren't. Customer service, for example, 459 cases this year. However, it took them on average 1 extra day to resolve the issues. PRC, on the other hand, shaved 45 days off the amount of time it takes to resolve a ticket. Overall, though, it amounted to 2 days being cut off on average to close tickets, an improvement of 5%. Well done. The next page, the top issues for the city. I don't think anybody would be surprised that potholes hit the top spot. 948 tickets last year, an average age of 25 days to fix or to close a pothole ticket. The year before, it had been 27 days, so 2 days shaved off. That's excellent news. Again, I think you may have the sheets in front of you. I hope you do. There were some winners and losers. Potholes shaved time off. General roads inquiry shaved 5 days off. Road conditions shaved 11 days off. So overall, good news. Caution on that, though. Based on my personal experience, it's unclear whether closed actually means work done or just ticket closed. And it's unclear if these performance levels are what residents really expect. So, for example, do residents want 25 days to fix a pothole? We don't have service levels on our services, so it's really hard to tell. I ran into a number of issues on doing the data analysis. There are a lot of data anomalies in Report It. I've provided those to the manager of customer services, so maybe they can fix that and make the analysis easier next year if I redo it. Also, the data provided doesn't provide the amount of detail I need to know whether the ticket was fully resolved or the ticket was just closed. So MFIPA does not allow certain data to go out, for example, issuer name or address. And so those fields were not made available to me. The next page, my personal experience. So I opened 7 tickets this year. 2 were handled immediately by customer service staff. Very good. The remainder took 7 months, including 3 months for where they were in the hands of the customer service manager. None of the tickets resulted in actual work being done. 1 was resolved by a call from the department. 2 were closed with the work not being done but reported as being done erroneously. And 2 were closed after being combined into a new ticket to be addressed in 2025. That is not my ticket, and I don't know the details of it. During those months, I had no report on the progress of the tickets, even after repeated calls to customer service, until the customer service manager took over all of my tickets in September. And I had to ask specifically for a summary of my issues and was not provided the details in writing. So my recommendations. Service excellence is working, so your program is working. It should remain a high priority. I would recommend that you add the performance data that I have, you can redo it yourselves, to the service dashboard so people know not only that there are 900 potholes that you're working on, but how long it takes to fix a pothole. That you communicate the status back to reporters, myself and other reporters, and you provide written details of the work that's done to resolve the issue. And that you seek feedback from issue reporters like myself on their satisfaction. Further, I would love to continue my analysis. If I could have the data on what was done to resolve the ticket, I can give you more information on whether it satisfied the need or not. To do that, I would sign a non-disclosure agreement, or the city could declare me an agent for this to satisfy MFIPA rules, and I would do the analysis and report back to council. So finally, then there's 3 things that I would ask of council: that staff figure out a way to provide the balance of the data to me so I can perform the analysis and get back to council. That staff seek to do customer satisfaction surveys on reported tickets, and that staff add ticket performance to the service dashboard. There you go. Any questions or comments?
Thank you. Let's find out. Could I get a motion to receive the deputation from Mr. Webb? Councillor Joyce, Councillor Warren. Questions for the deputant? Seeing none, we do have, Councillor Richardson.
Thank you, and through you, Mr. Mayor. Thank you, Mr. Webb, for coming today and providing some comments and observations. And I know that you've had this on your radar. I think we first connected, I think it was January 2021, if I remember correctly. And
I think so, yeah.
yeah, so I just want to say that, you know, in the presentations that we are receiving today, Manager Clarkson has, you know, he's going to be presenting how we're providing a better experience and we're looking at that measurement tool. But, you know, in essence of what you have said and based on your observations for the last few years, is clearly, you can clearly say that we are moving in the right direction, correctly?
Absolutely. Absolutely. Yeah. The one comment I will make though is, so the ticket aging is coming down, but that may be a result of more attention paid to closing the tickets, and it doesn't necessarily say much about the work being done in the ticket. So for example, I had 2 tickets this year that were closed erroneously. The work was done and closed, but that wasn't true. It never got back to me. So
well,
I think, yeah, go ahead.
No, and sometimes there is, you know, obviously there's reasons why things like that do happen. If it's a resource issue or time thing, you know, the folks do have work orders, and if something comes in, you know, we're still following our work plans because that's the most financially forward way of moving forward. So I just appreciate the fact that you've spent the time doing this, but also want to say that it's clear to see that we are moving in the right direction. So thank you.
Absolutely. Absolutely. No question. Yep.
Thank you. And you do know that there are, Councillor Warren, do you have a question or a comment?
Yeah, a comment, actually, as a question to David. So have you talked to staff about your further initiatives that would make it even a better report?
So I've mentioned that to customer service. I've spoken with Brandon a few times about his work, and so yeah, and Steve Babcock before him. Yes.
Mm-hmm.
Yeah. So the point about getting the additional information to find out whether the tickets are actually being closed appropriately or not, I've not spoken with Brandon on that particular one.
Okay, so going forward, that's what you're looking for.
Absolutely, that's correct.
Right.
Yeah.
Okay. Thank you.
So you know that we do have a presentation on customer service later in our agenda, and perhaps some of those questions will be answered. Thank you for coming today.
All right, thanks.
We have a motion to receive. All in favor? And that's passed. Councillor Richardson, I was thinking you could do your announcement when we reconvene at 1 o'clock. Is that fine with you? Thank you. So moving on to item 6 is presentations, and our first presentation is the introduction to the Medical Priority Dispatch System, MPDS, and the 2024 Key Performance Indicators, KPIs for paramedic service, and that will be by our Chief, Sarah Johnson, and Dr. Michael Feldman. So, folks, whenever you're ready, go ahead.
Thank you, Mr. Mayor, and good morning, everybody. Really pleased to be here this morning to talk to you about paramedic service and give our annual update. This morning, we're going to be breaking up our presentation into 2 parts. The first is going to introduce the modernization of the ambulance dispatch system. It's called the Medical Priority Dispatch System, or MPDS for short, and Dr. Feldman is going to present on that. And the second part of the presentation is our annual performance report that you're used to seeing from us. So I'd like to just give a few introductions to our team. Paramedic service is divided into 3 main pillars. We have operations, which is led by Deputy Chief Stephen Lucas. He's not able to be here today. He's on a course, but sends his regrets. We have our administration division, which is led by our executive assistant, Renee Ford, who is here. And we have professional standards, which is led by our other Deputy Chief, Jamie Golden, also here. And all of those portfolios, the department in general, supported really heavily by our superintendent group. And one of those key people are here today, and that is Superintendent of Community Paramedicine, Autumn Campbell. So just to get started, we're going to talk about the modernization of the ambulance dispatch system. And with that, I have the pleasure of introducing Dr. Michael Feldman. Dr. Feldman is an emerge physician at Sunnybrook and Collingwood and also an associate professor at the University of Toronto. Interestingly, he worked as a paramedic and an ambulance dispatcher for 12 years before getting his PhD. And he's held other roles, including the medical director for Toronto Fire Service. He is currently the medical director for other paramedic services north of the GTA and is the medical director for the dispatch of the province of Ontario. So I really can't think of maybe somebody who might be busier, but also better suited to provide the update. So pleased to welcome Dr. Feldman.
Thank you, Dr. Feldman, whenever you're ready. Thank you for coming.
Thank you very much, Mr. Mayor and members of council and Chief Johnston. It's a pleasure to be here. I do have an associated PowerPoint presentation. Is that something that Chief Johnston is going to display? And then I'll just tell you when to advance the slides. Great, thank you. So thank you for the introduction. Just to give you an idea of my position in this, Chief Johnston introduced my professional roles, and I'm going to talk about a provincial initiative, a project that's been going on through the entire province of Ontario. But I advise the province of Ontario as an independent medical practitioner. So I'm not an employee of the Ministry of Health, or I'm not an employee of the ambulance dispatch centers, but rather I provide my independent medical opinion. And I'm very excited and encouraged about this project that we're involved with right now. I put the key messages, the takeaways for this project and for this talk on this front slide, so that if you tune out for any part of it or any part of it seems unclear, this is the part that I'd like to leave you with. Currently, Ontario's, when you call 911, the ambulance communications officers will ask a series of questions, and these questions is a protocol that was written on Ontario about 25 years ago. It's received very little in the way of modification since, and it has a tendency to over-prioritize call. The medical priority dispatch system is really the standard of care in dispatch. It's a better dispatch tool. It asks more detailed questions, and studies have shown that it's a more accurate way of assessing the urgency of 911 calls and prioritizing them. Generally, in cities and towns that have implemented it, it has decreased unnecessary lights and sirens responses. Now, this is not a move by the provincial government to remove or limit any resources. From what I've been able to observe, the province of Ontario has actually devoted significant resources into implementing this tool, and basically brings us up to the standard used in many parts of the world. We may see as a benefit, because it's more accurate, that some of the more urgent calls may see some improved response times. There may be some delays possible to lower acuity calls. That's not to say that delays haven't happened. In many towns around Ontario, because of the over-prioritization, ambulances were often depleted, leaving few or no ambulances available. This just provides a more structured way to know which calls need the ambulance the quickest. And when there are delays, they will generally be relegated to calls where we feel it's safer to do so. The launch at the Lindsay Central Ambulance Communications Center is going to take place overnight, March 26th to 27th, 2025. So this is for information only. It's taking place throughout the province. Next slide, please. So under the old protocol, about 70 to 80% of calls were judged to be lights and sirens emergencies, but we know historically that when paramedics arrive, only 5 to 10% of the calls are actually life-threatening. In the orange slice of the pie chart are the ones that were dispatched as non-lights and sirens, but unfortunately, because of the inaccuracy of the old protocol, up to 3 to 4% of those calls actually should have been lights and sirens, so we were missing some. So what the old protocol was doing was depleting resources by dispatching most of the calls lights and sirens, and it was introducing delays in an unstructured manner for calls that should have had an emergency response. Next slide, please. To give you an idea of what that looked like in Kawartha Lakes with data that was kindly provided by Chief Johnston, in 2023, there was about 9,400 emergency calls, and only less than 10% of them needed lights and sirens transportation by paramedics. In 2024 was similar. There was about 9,500 emergency calls, and only 1,000 needed emergency transport. You can see that when call after call comes in and you have to dispatch an ambulance immediately, this tended to deplete resources, and in some communities, there were sometimes no ambulances available for a period of time for the next 911 call until an ambulance would become available. Next slide, please. So the new protocol, the medical priority dispatch system, was developed by a doctor who was also, like me, an ambulance dispatcher for a period of time. It was developed in the 1970s, and it's currently used in over 5,000 dispatch centers. It's been translated into 46 languages. It's used in countries around the world, ranging from all of England to Saudi Arabia to countries in Asia to the UK. It's been the standard of care used in Toronto for decades, for the entire province of British Columbia, and it's really well studied. One of the things they do when they study it is they look for opportunities for improvement, and we're currently on the 14th version of this protocol. If you wanted to contrast the system in Ontario, the system in Ontario didn't have any kind of built-in performance improvement, and we're on the second version. So this new version keeps getting improved and improved based on data. In addition to prioritizing calls more accurately, it also provides an enhanced set of first aid and CPR instructions to the 911 callers to help them provide the initial first aid, even if they're not normally trained to do so. And the priority that it tells us is really based both on the patient acuity in the medical protocol, but also on medical evidence. So one of the things we've done to adapt it locally in cities where it's been used for many years, like Niagara and Toronto, is we've been able to link the dispatch information with what the paramedics have found, and we've basically adapted the protocol to provide the best possible determination of patient acuity. No complete precision is possible. We're talking to a 911 caller who may be a layperson and may not completely understand what they're seeing, but the ambulance communications officer will guide them through a series of questions and help determine, for example, whether they're having a stroke or a heart attack or a cardiac arrest, and provide necessary instructions. And they'll be dispatching the ambulance while they're going through the questioning and providing first aid instructions. So it doesn't delay access to an ambulance. Next slide, please. Under the new protocol, instead of 2 priorities, there are 5 new priorities. Excuse me. Like the old protocol, it does tend to be on the conservative and safe side, and it will dispatch calls as lights and sirens responses when there is a significant chance of a life-threatening problem. So the highest priority, the purple priority, usually these are cardiac or respiratory arrests, and when a 911 caller calls in describing this, an ambulance is dispatched immediately. In many communities, there's also a tiered response with local firefighters. And 58% of these turn out to be life-threatening. The next priority, the red priority, is often much lower risk of being life-threatening, but these are also dispatched as lights and sirens responses. And then the 3 lowest priorities, orange, yellow, and green, have between a 0.1 and a 0.4% chance of being life-threatening. And there is a delay potentially allowed. The delay is not universally applied. It's only when there are insufficient resources to dispatch. So even a green priority, we would dispatch an ambulance immediately if available. The difference with the bottom 3 priorities is that they're not dispatched with lights and sirens. The results of this is there will be a decrease in lights and sirens responses. Evidence has shown that there's increased safety with decreased risk for collision of emergency vehicles. And it's not just emergency vehicles, it's also vehicles sort of in the wake of an emergency response have been shown to have an increased risk of collision behind the emergency vehicle after it clears the intersection. In calls where there is a delay in ambulance response, there are regular patient callbacks scheduled, and if there's any change in the patient condition, the call gets upgraded. Next slide, please. The overall community impact is that in the reds and purple calls, there is a chance for improved response times to some calls. In communities that were very, very well resourced or close to ambulance stations, you won't notice much difference. But in some rural communities or some busy urban municipalities where they regularly deplete their ambulances, they'll notice improved response times to the lights and sirens calls. This will be counterbalanced by delays to others, but as I said, we have always had delays in our system. It'll be counterbalanced by delays to calls where the chance of high acuity is much lower, below 0.5%. We feel this will optimize paramedic resource utilization, and we've observed this in the 7 or 8 dispatchers where it's already gone live in Ontario. The paramedic services have some work to do, and City of Kawartha Lakes is no different. That where there are existing tiered response agreements, the paramedic services have found that the new protocol uses different language to describe the call types, and therefore they're trying to align their tiered responses to match what we were doing under the old protocol. Members of the public will spend more time on the 911 call with an ambulance communications officer. This is often while the ambulance is on its way, as we're getting more detailed information, but it also takes time to provide more detailed instructions. This time on the 911 call does not delay the ambulance response. The ambulance is often already on its way. One of the things that is built into this project is data analysis, so that once it's implemented, the Ministry of Health is not just walking away from the project, but will be continually analyzing and improving the system. And lastly, one of the other things that's built into the system is the province has implemented reporting committees with representation from each of the local communities, paramedic services, and ambulance communication center, so that adjustments can be made at the local level. And all communities in Ontario that are implementing this will have increased representation to make sure the system meets the needs of the community. Next slide, please. Thank you. That ends my portion of the talk. I'm happy to take any questions.
Thank you. Yeah, we'll do some questions if we can. First, can I get a motion to receive that portion of the deputation? Councillor Warren, seconder, Councillor Perry. Questions, Councillor Warren?
Yes, thank you very much. That was a very interesting presentation, and it's good some positive changes are going to happen. Just a couple of quick questions. Will there need to be more dispatchers if you're going to have dispatchers keep people on the line to make sure that they don't get worse? That's my first question. So you need more people, I would think.
Councillor Warren, that's a great question. I'm not the Ministry of Health, but I can tell you that I have observed that that some dispatch centers have seen increased workload, and in some cases, implementation has been delayed until they could hire more dispatchers to handle the increased workload. My understanding from my Ministry of Health colleagues is that they have been hiring more dispatchers to handle the workload. I don't know specifically what's happening at Lindsay Central Ambulance Communication Center, but I imagine that if they experience these same challenges as I saw they observed in Mississauga and Barrie, that they will be compelled to hire more dispatchers if they haven't done so already.
Thank you. And also, you mentioned fire service. I think at this point they only go to code 4, so I'm just wondering if I guess it's up to the municipality whether they want to have that service to actually service people that, especially when the ambulance, maybe it's a zero ambulance issue, that they can be brought in. But that would be, not a cost for the province, but it would be a cost for the municipality. Is that correct?
That's also a very insightful question. Thank you. To give you an example of how it might impact a tiered response agreement and code 4s, which was the old lights and siren response, code 4s are now roughly equivalent to the red and purple priority. in the old Code 4s, I'll use a chest pain as an example. A chest pain was a chest pain was a chest pain, no matter who was suffering from it and no matter what the reason. So, for example, if you had some kids playing baseball and a 17-year-old, threw a ball, pulled a chest muscle, and they were describing chest pain, that would automatically be a Code 4. And if your municipality's tiered response agreement said that you were to go to Code 4 chest pains, you would be going. Under the new system, they actually distinguish. When the patient arrives in the emergency department, I'm obviously not searching for a heart attack or doing the same tests on the 17-year-old as I am on the 80-year-old who's suffering from chest pain. Under the new system, that 17-year-old with a pulled chest muscle won't be a red or a purple. And so one of the things the paramedic service would have been doing up to now is to decipher the intent of the old tiered response agreement, and a non-urgent chest pain call, which is no longer a Code 4, would likely not receive a tiered response. I can't speak to the specifics of what's been done in the city of Kawartha Lakes, but that kind of translation has had to happen. And in any cities where you were responding to lights and sirens calls, they tend to go down from the 70 to 80% range down to the approximately 50% range of calls. And so there's likely going to be an impact on tiered responses. I can't speak to the specifics in the city of Kawartha Lakes, though.
Okay, thank you. I guess that's something I need to speak with staff about, fire and ambulance. Thank you.
Thank you. Councillor Richardson.
Thank you, and through you, Mr. Mayor. Thank you, Dr. Feldman. It's very enlightening just to see the opportunities that actually are coming our way to make a better response time. Just a curiosity question. This is rolled out in other municipalities, and there's that transition time between, like, March 27th, as we're saying, when the new system is put in place. Have you historically seen when municipalities have moved there, like a lag time or any issues between the two systems collaborating?
Thank you very much, Councillor Richardson. The actual switchover sort of takes place at around 1 or 2 in the morning at a period of historically very low call volumes. And there's the switchover is sort of instantaneous. When all the systems are up and running, the ambulance communications officer takes over on the new system, and there's a team of support staff from the Ministry of Health that are in place physically overnight during that switchover. There were some transitional issues, like when you were communicating with other ambulance communication centers which were using the old system. They may take a 911 call within your region just from how the call landed on a cell phone tower. Many of your neighboring municipalities have already switched over. So, for example, Kingston Central Ambulance Communication Center switched over on February 5th. The Georgian Central Ambulance Communications Center switched over on in November 5th. And so border calls have to be translated, and the Ministry of Health has a policy on that. But because many of the bordering areas around you have already switched over, that translation actually is going to disappear, and it's going to become easier. And then the Oshawa Central Ambulance Communications Center is switching over, I believe, in May. So everyone will be on this new protocol in and around the city of Kawartha Lakes very soon. North of you, that's going to take place, I think, a little bit later.
All right, we have a motion to receive. All in favor? And that's done. Thank you. Moving on to the second part of the presentation, Chief Johnson, whenever you're ready.
Thank you, and thanks, Dr. Feldman, for that update. Much more articulate and insightful than I would have been for that project. So
yes, are you staying for the next part of the presentation, Dr. Feldman? You're welcome to do so.
If you don't mind, Mr. Mayor, just for my interest and because I've been working closely with Chief Johnson, I'd be very interested in hearing her report.
You're welcome to stay. Thank you.
Okay, so we're going to transition to a discussion around our annual performance of the department, or how do we do in 2024. And having seen this report before and having provided the information to Council previously, we know that KPIs help us track our progress year over year. And it also helps to make really well-informed, evidence-based decisions. So we have our master plan that provides the general roadmap and recommendations, but is the performance of the department making sure that we're making those changes at key points when we need to, rather than at an arbitrary point in time. It's always nice to have comparator information or be able to measure ourselves or our performance against our peers or our neighbors. Ontario really has limited paramedic data, but there is one very good source of information coming from the Municipal Benchmarking Network, or the MBN. The MBN tracks 6 EMS metrics, and it's important to note that while this is providing those good comparators, the last published report on EMS was in 2021. So just keep that in mind as we're walking through that the information is slightly less reliable and a few years out of date. So this is a really important one for us. This is our call volume, or the demand for ambulance service in Kawartha Lakes, and we're going to focus first on the graph to the right. So that's all vehicle assignments in Kawartha Lakes for the last 5 years, with 2024 showing in the top bar. The dark blue and teal are patient-related calls or interactions, and the gold shows the amount of code 8s or standbys that the service is doing. So just out of context, a standby or a code 8 is a call for ambulance coverage when that one area's resources are depleted. So what that means is when Lindsay gets to be really busy, we'll move a Pontypool from Pontypool, for example, to standby or to cover that area until we can get some resources freed up and available. So the trend to the graph to the right is that we're seeing the patient-related volume, the blue and the teal, increasing year over year. And because of that, we've had to make some adjustments, particularly to our mobile deployment strategy, in decreasing the amount of code 8s. And it makes sense if you consider our paramedics are busier on patient-related calls and interactions, and they're just less available for those standby movements. If you take out the gold and you isolate the patient-related calls, you get the graph on the left-hand side, and that shows the trend a little bit more clearly there for you to say in 2024, we had growth of about 1.5% in our call volume, patient-related calls. Out of interest, that's just shy of 14,000 911 calls for service for patients in 2024, which is about one call every 38 minutes. So it's a busy system. There's a few key takeaways from this slide. One, the call volume over the last 4 years has been growing year over year. We've leveled off to somewhat more of a stable and predictable rate of increase, but the facility, new Lindsay Station facility project that is in the capital works for in the next few years, it can't come soon enough to make sure that we're best prepared to handle that growth, that we have the flexibility to meet the needs of the community as we continue to get bigger and busier. The other takeaway from this is that next time you see this report, the calls will be categorized by color instead of number. So you'll see that change next year, and the goal is to better prioritize the urgency of the patients that are calling 911. This is a brief and good news story. So despite changing our mobile deployment strategy, we are still meeting and exceeding all response times. So if you're wondering, what impact that's having in the background, we're still meeting all the targets that we're setting out. We haven't changed those targets in the last few years, so that's a very positive, good news story. This is a volume measure per capita, or essentially how many calls do we receive per 1,000 people. And the top right graph looks at the emergency calls. The bottom right looks at the non-urgent calls. And the non-urgent calls are very low, predominantly because of the non-urgent transportation agreement we have with Community Care. If we go back up to the top right, you can see that yellow line across the graph, and that indicates the Municipal Benchmarking Network average, which is 127 calls per 1,000. And the City of Kawartha Lakes residents are more likely or have a higher propensity to call 911. We're quite a bit higher than that, 174 calls per 1,000 residents over the course of a year. likely predominantly due to a few reasons. The age of the population, first and foremost, is more senior than average, and the availability or lack thereof of resources outside of calling 911. So things like urgent care clinics, access to primary care, those sorts of things, as a reason that we're seeing those numbers so much higher. This is a critical measure for us. It's system utilization or system busyness. It's one that we use internally a lot. And it's shown graphically here in two ways. So the first graph is the top right, and that's called unit hour utilization, or UHU. It's essentially the percentage of time that our paramedics are actively involved with a patient. So there's lots of things that they do throughout the day that is not taken into an account here, things like documentation, restocking between calls. It's strictly the amount of time they're with a patient, they can't do anything else. There's no set ratio, but as a general rule, the industry accepts 35% as the maximum risk tolerance of how busy you want that system to be. The fear or the risk of getting higher than 35%, it can signal that your system is too busy and you don't have ambulances available for the next call. So that's kind of the standard threshold. That threshold is marked with a yellow line, and you can see in 2023 that we were getting really close, creeping up to that 35%. And with support of everybody here, we implemented a really key change in adding an ambulance through the day in Lindsay in 2024. And we knew that was going to have an impact. We just didn't quite know how drastic the impact was going to be. And it decreased our UHU down to just shy of 30%. So that allows us to more evenly distribute the workload. It means that our system isn't at that critical breaking point and has a little bit of a buffer or cushion for growth as we get those increased numbers year over year. The other one that is always an important metric to look at is our ambulance code 0 rate. That's the bottom graph on the right. And that's the amount of time that we're spending with no ambulances available in the city of Kawartha Lakes. So that means we have more calls coming in than ambulances available. It's a very risky point of time. Essentially, it means that if a new ambulance call comes in, when that happens, that we either have to free a resource up, we have to clear them from whatever it is they're doing, or somebody responds from an outside service, Peterborough, Haliburton, Durham, etc. So you can see the fairly alarming trend from 2020 to 2023 was on the upward progression. The addition of the ambulance in Lindsay on days and the implementation of the dedicated offload nurse program has cut that number in half, which is hugely impressive and a wonderful success, something that it shows the power of data in making these key decisions, adding resources when we need them. And we're now spending about 86 hours total per year, which is down about 50% from previous year. So very good story there as well. This is our cross-border volume. So the dark blue indicates the calls that we are servicing in other municipalities. So the amount of times we're going into another area to do a call. And the teal is the amount of calls that are being done in Kawartha Lakes by other municipalities. And it's a pretty clear picture that overall we're a net receiver of mutual aid from other services. This metric is an indicator of the time that our ambulances, our paramedics are spending in hospital. It's also an indicator of offload delay and what's going on there. It looks fairly complicated. It's a graph showing 3 years of data, and we're going to focus on the second cluster. I don't know if you can see that with this one here. And that's the average offload time. This was a huge priority for us in 2024. There was a lot of focus and effort and man hours put into trying to come together to mitigate this as much as we could. We have very strong relationships with our local hospital that have been working tirelessly on the dedicated offload nurse program funding and other initiatives like Fit to Sit. We have champions of community paramedicine that are trying to divert patient volume from the hospital where we can, and all those things together made a really drastic improvement in 2024. Our average offload delay is down in this past year, but probably more impressive is the improvement in all areas We have delays, total offload time delay reduction of about 46%. And that means that we saved probably about 1,400 hours that our paramedics were sitting at the hospital monitoring a patient until they could offload to a hospital stretcher. And again, wonderful story here. The service in the city has committed to providing the highest level of care possible to the community. We do that by a very robust training and education program, but also through our advanced care paramedic program. You can see in dark blue that the vast majority of our calls both receive an advanced care paramedic response, but also are transported with an advanced care paramedic on board. And that's very positive. It's good news for patient care in being able to provide those advanced interventions when patients need them the most, things like pain control, airway support, et cetera. I'm going to transition the last few slides. This one looks at finance or funding measures, and the graph shows 3 different versions of the measure. The first is operating cost per capita, the second is operating cost per event, and the last is operating cost per unit hour. And that last or third cluster is the one we're going to focus on. There is a municipal benchmarking network average comparator of $241 per hour. That number was produced or published in 2021. I would anticipate it being higher at this point. But in 2024, we saw our operating cost rise slightly, mainly because of the additional ambulance in Lindsay, but just the increasing cost of inflation, supplies, expenses. And we are hovering around $246 per unit hour that our crews are in service. This is another version of finance measures. It isolates what it costs to operate our fleet alone. We're going to focus on the top right graph, which is our operating costs over the last 5 years. So 2024 is showing on the last bar to the right, and you can see a slight decrease. It's not very obvious on this graph, but a slight decrease in 2024, and it was more happenstance. We've been keeping up with a similar preventative maintenance programs. It was just less significant and extensive vehicle repairs in 2024. We worked with council and corporate services significantly the end of last year on an early start for ambulances to replace them, hopefully on time. Right now, the turnaround time to get an ambulance in stock is about 18 to 24 months. So we really need to be making sure we're putting in the deposit, we're getting in the queue early so that we replace those vehicles on time rather than trying to limp them along after end of life, which is what's happening now. I'm not going to focus specifically on this. Our carbon emissions are down. We're doing less standby, so we're doing less driving, equals less carbon emissions. I'm going to be brief here. Public satisfaction. We rolled out a customer satisfaction survey, patient satisfaction survey in 2024. The uptake on the survey was quite low. We didn't have a lot of people complete the survey, and it really wasn't providing the level of feedback that we were looking for to improve service. So we're back at it. It'll be under construction in 2025 to figure out more meaningful ways to engage, how we get the word out there and get people to participate. This is the last one that I want to talk about, and this is occupational health and safety. The top graph, the left cluster shows the injury frequency rate, so the total injury frequency rate, and the cluster on the right shows out of those how many are lost time injuries, and we see both of those increasing over the last 3 years. The highlight is an edit to the report that was sent out on Friday. It's the power of average or total, and I made a mistake in my report, but what that indicates is the bottom right graph shows out of the amount of new injuries that we had over the course of the year, how much lost time did we have total? And out of those new incidents, we lost about 2,000 hours. That equates to almost one full-time person off at any point of time due to illness, injury, mental stress injury, et cetera. So we're hoping that MPDS is going to help to alleviate some of those workload pressures that we have, reducing shift overrun, so the amount of overtime that our paramedics are working at the end of shift, improving just time that they can get to catch a meal throughout their shift, which will be nice, and looking at this as a priority area for 2025. Oh, there was an extra one. This just shows the additional staff that was added in 2024, that we're having a few more paramedic practitioners per capita. A few key takeaways. We know that our service demand is increasing, but the good news is that that increase has returned to a little bit more of a stable and predictable rate. Our code 0 in our UHU has decreased, which, as I mentioned at the beginning, really validates the master plan, the roadmap, and making sure that we're using the data to time those changes at the right point. Our costs are increasing, but on par with the 2021 Municipal Benchmarking Network comparator. Our injury rates need attention, will be a priority area for this year. Our fleet costs have improved, but our maintenance budget will still be exceeded due to the aging fleet until we can stabilize and get those new units here. And our new survey didn't quite capture what we were looking for, so we tried, and we're going to try again this year. That's it for my formal presentation, but I'm happy to answer any questions.
Okay, we do have a couple of questions. First, I'll get a motion to receive your presentation. Councillor Richardson, Deputy Mayor McDonald, and first up, Councillor Richardson.
Thank you, and through you, Mr. Mayor. Thank you, Chief Johnson, and all your staff here today. It's, when I was reviewing this, I was looking at it going, wow, the last few years we've been, really looking at deficiencies and, how do we change? Well, this is actually an amazing story for the city of Kawartha Lakes, because you've made so many changes in the last year based on data, and it's showing now, which is incredible. And that just shows the service that we're providing to the residents of Kawartha Lakes. I'm just wondering if, outside of what you've spoken about today, just maybe talk about the impact of that new paramedic station that we are going to be moving forward with, and how that's going to help as well service our residents better.
Through you, Mr. Mayor, to Councillor Richardson, it's a really great question and briefly mentioned, but as we're seeing that growth year over year and adding resources, we're really busting at the seams. There's simple things like not enough room at those stations for staff. For ambulances, we're having to park units outside. Staff don't have lockers or appropriate facilities to get ready for their shift. And when everybody's there, it's quite crowded, not to mention the maintenance issues of our facilities. So that station is critical to better prepare to meet those community needs as we grow year over year, to have space to expand into, to park our units inside, to staff the people that we need to do the work and to respond in the community. So I think we gave a really extensive presentation back in the fall, and I stand behind all of those reasons that we're pushing it forward, and knowing that it's a need for the service, it's a need for the community to best respond to the growth that we're going to see, not just next year, but multiple years to come, when that's a little bit more exaggerated with the population growth we're expecting.
Well, you certainly should be congratulated, because, like I said, we've had years of focusing on deficiencies, but looking at today's report, just the impact that has with your changes has made such a dramatic change, and I just look forward to the future. So thank you.
Thank you, Deputy Mayor McDonald.
Yeah, through you, Mr. Mayor. Thank you, Chief Johnston, for your performance indicators today. And how you measure, it's excellent. Well done, and you show you didn't miss anything. Okay, so thank you for that, and the report is really good. I got a couple of comments and a question. A couple of comments. It's really nice to see that when the people sitting around the table here make some decisions on adding an ambulance and so on, but now we can actually see the results. And I think that's really important, because we make a lot of decisions around this table, but sometimes we don't really actually see the results of it. So well done. I think it's good for all of us to see those results. And one other comment was, when you talk about offloads, like I don't know how many times I used to drive by the hospital and I used to see 6 or 7 ambulances there, which meaning that they aren't on the road, which is pretty serious. And great job for reducing that. I drive by now, I hardly see anybody there. Like, used to be stacked up on top of each other for a long time. So that's something visual that everybody sees. So well done on that. The only question I have is that when you, in the figure 16, when you talk about hours lost with WSIB, 170 shifts, 12-hour shifts and so on, and $450,000 it costs for that. Could you explain to me what type of injuries that we were dealing with and so on? I'm not sure if you can help me out with that.
Through you, Mr. Mayor, Councillor. The vast majority of those are for mental stress injury. A combination of newer staff right through to our most experienced, so it's a pretty complex issue to tackle, but one that we have to figure out ways to make sure that our staff are healthy and well when they're in the workplace to do the challenging work that they do, but when they're off and they need to take a break, how do we best support them when they're away from work? And there's a physical component to that, rehabilitating through an injury, but also quite a complex road that they're taking for recovering from a mental stress injury, and very similar to a priority area and offload or whatever it is. It's a key area for us for this year to all come together and work on it.
Thank you very much, and keep up the great work. Thanks.
Thank you. I got Councillor Joyce, followed by Councillor Warren.
Thank you, Mr. Mayor. And through you, I got a few questions, and yes, I agree. Great presentation. Thank you for all the data and whatnot, and the research. I know it's very time-consuming and it's very thorough. My questions, one is code zeros dropping down precipitously is great news. That was a huge concern when you were standing here last year talking about this. But my question, is it all due to the addition of an ambulance? I know, put it this way, someone told me that by closing the Minden Hospital, which was not really a hospital, and with their lack of staff and equipment, a lot of cases that came in there meant Halliburton had to send an ambulance down to RMH, and then we, with our cross-border agreement, had to put an ambulance on standby to fill that gap. Well, that's not happening anymore. Has that helped reduce our code zeros as well?
Through you, Mr. Mayor. I don't know if that, there's so many contributing factors. It's not just the additional ambulance, it's not just the offload nurse program, it's not just the community paramedicine program, it's all of those things together. Offload's it's a patient flow issue at the hospital. You can't discount patients coming in from other facilities, whether it be Minden or Halliburton. That puts pressure on the Ross, whether it's in the emerge department or on the floor, and that trickles down to us, bringing more patients in. It's a patient flow issue. So I don't know the amount or the degree of impact that it's had. I wouldn't disclude it. I just don't think it's a primary reason for the decrease.
Okay, fair enough. I just, these are less urgent. These are actually not ambulance calls. These are people driving to a hospital emergency room that are then transported. Is where I'm going. So they're instead going to either Halliburton or RMH directly. Ambulance is not involved. Cross-border, we're still getting service assistance from Peterborough Durham. Do we need a cross-border agreement? Is that in process? If you can comment on, is that something that we should have in place, or it really doesn't matter?
Through you, Mr. Mayor, it's a good question. So we have one cross-border agreement with Halliburton County. We are a net receiver of support from them, and the City of Kawartha Lakes pays the County of Halliburton for that time. Peterborough would be close to an equal distribution, so there would be very little money exchange. We go into Peterborough, they come to us, and it's almost even. The exchange would be with Durham Region. Durham Region services way more calls for us than we service in Durham Region, and we would be a net payer of service. It's a bit of a double-edged sword. It helps support more services in Kawartha Lakes if we were to be paying Durham. But the ultimate plan is to make sure that we're distributing our resources appropriately. Right now, the crews that are sitting in Pontypool are doing more code 8s and less calls. The more appropriate location for them is probably in the Oakwood area, according to our master plan and from what we're seeing, which would cut down on that cross-border support from Durham. So we need a better plan than what we have now. There's nowhere to house those resources. Millbrook just opened a station, but right now they're used in Peterborough most of the day and not supporting the Pontypool residents in that area for paramedic response. So there needs to be some more work in the background before we just arbitrarily move things to Oakwood, though it would cut down on cross-border support in that area. Yeah.
Okay, good. Thank you very much. Just a comment on the operating costs. I know we have a practice of an advanced care paramedic in tandem with, a regular paramedic. Sorry for terming it wrong. I'm fully in support of that. I know other municipalities do not support advanced paramedics, and they probably have a lower cost per hour, but we should continue in what we have going. Last question is also health, occupational health and safety. How do we compare? Is there an Ontario average we can look at, or how do we compare in that scenario?
Through you, Mr. Mayor, it is an issue across the board. Every service is having pressures related to WSIB-related expenses, physical and mental stress injury. We're actually shaping up a little bit better than some of our comparators, but there are more larger provincial issues with advocacy around WSIB, decreasing wait times to make sure that claims are handled quickly, and that we have a resolution of those to know whether the claim's accepted or not. So we're doing a little bit better, but it's not to exclude the fact that it's a pretty large pressure for us. WSIB expenses were about $450,000 last year, which is significant for what that means in Kawartha Lakes.
Okay, no, thank you. The mental health of our paramedics is a very primary concern, absolutely. I was just curious if our number of incidences were higher or lower on the average, the provincial average.
Without having the data in front of me, anecdotally and from what I've heard from other services, some other data I've seen, we're on par or lower.
And last question is the offload nurse program. It's my understanding we got temporary funding for 2024. Do you see us getting that continued, and will it be permanent eventually?
Through you, Mr. Mayor, the application is submitted, so Deputy Chief Golden increased the application and the request for funding for next year. The funding actually starts on April the 1st, so we're really hoping for timely news from the ministry as to whether or not it continues, and if it continues at our current rate or funding's increased. So fingers crossed that it will be good news for April 1st.
Fingers crossed, thank you.
Thank you. Councillor Warren.
Yeah, through you, Mr. Mayor, and I had that question for the chief yesterday. So are we applying for maybe 1.5 offloading nurses, because it's been such a great way to bring down the statistics? So not just to keep what we already have, because if we lose that, that would be really devastating. So how much are we applying for, like 1.5 or 2?
We've applied
That's
for,
my first question.
yeah, through you, Mr. Mayor, to Councillor Warren, we've applied for a nurse for 12 hours a day, 365 days a year. When the funding was originally provided, the Ross wasn't able to staff every day, so we received just shy of $200,000 for the year. We've requested $318,000 for this year, which will allow us to staff consistently every single day. And we're hoping that that's considered by the ministry when they provide our notice.
Great. So, and just a couple other comments and questions. When did did we stop bypassing? Like, when did we start that standby? Sorry.
Through you, Mr. Mayor.
When do we, yeah.
The service experienced incredible growth in 2021. It was felt across the province, very similar trend with other paramedic services and emergency departments, likely due to COVID. And with that, it was almost a 12.5% increase that year. So we had to make an adjustment, and that's when we started to decrease our standbys or our Code 8 assignments.
And we also have, do we still have a traveling paramedic vehicle, like an SUV that goes and helps out? I know there used to be.
Through you, Mr. Mayor, our superintendent group, our operational superintendents work in an SUV. So it's decoed. You may have seen it around town. They usually drive in a Tahoe that's fully marked. They are there to support our staff 24/7 on the road. They act as a supervisor, but they also respond to calls. So if you see that unit, it is likely our supervisor.
And also, we talked about this, having fire being the first on scene when we have a zero issue. So working together to maybe do the top two codes. So right now, does fire go just to the color? I guess it was a code 4, and the next one down. If the ambulance isn't in the area, if we don't, cross border isn't able to get there in a good length of time.
Through you, Mr. Mayor, it's a long answer. I'll give you the short one, and that is anytime the ambulance is going to be delayed longer than 20 minutes, fire will respond on all purple and red calls.
Okay, that's good. Thank you. And it might be a conversation with fire to have a smaller vehicle to go to those calls too. Thank you.
Thank you, Councillor Perry.
Thank you, Mayor. And just very briefly, thanks so much, Chief, for the detailed report based on so much data analysis. So helpful. Just a quick question, if I could, perhaps revisiting a topic briefly in your presentation. I recall last year, it really struck me when you mentioned that such a high percentage of calls that EMS is receiving really aren't emergency or necessarily even health-related calls. I was just wondering if you'd be able to track that again this year. Has that increased in seemingly people's outreach or need to call someone, or if you've seen that continue at the same rate or perhaps decrease? If you could speak to that even anecdotally, that would be good to know. Thank you.
Sure. And through you, Mr. Mayor, to the councillor, you brought it very nicely back to MPDS and the implementation of why we're changing the dispatch system, and that is to better prioritize the urgency of patient needs. Communications has been very hard at work to produce a web page, a landing page for the public, for you all to go and look at and learn more about that program and why we're doing it. But yes, in order to make sure we're making the biggest change, it's working upstream before people call 911 to defer them from those services where we possibly can. And MPDS is going to help us do that, but also public education. What is an emergency and when is the most appropriate time to use 911 and emergency services?
Thank you. And a lot of that, to me, seems to be around isolation. Around a feeling of less empowerment these days, around needing someone to call. Are you still seeing those calls at the same volume, do you think, or has it been reduced or the same?
Through you, Mr. Mayor, I'd have to go back and look to give you a solid answer.
Yeah. I don't want to put you on the spot.
I'm unable to answer that.
Okay, thanks so much.
Thank you. I have one question, and it's being nitpicky. On slide 17, under 2023, under operating costs, there's a little red bump at the top. I just wondered what that was.
Mr. Mayor, is it this? Oh, you can't see it because it's behind you. Is it this that you're speaking of?
There's a little red bump under the 2023 number in operating costs per unit.
Is that what he's talking about? Yeah. So the red dash, the red dash is the municipal benchmarking network average. So that's the comparator.
Oh, okay.
So maybe not, I need to clarify that a little bit better on the slide, but that's the comparator amount. And the data below it in the 3 colored bars is our information for the last 3 years.
Okay. I didn't know if it was the extra ambulance and we had actually added it in late 23 and that caused the little bump, but, and I also wanted to prove to you that I looked at the slides. Okay, we got a motion to receive. All in favor? And that's passed. Thank you very much for a very comprehensive report. And thank you again, Dr. Feldman, for being with us this morning. We appreciate everything you've done. Have a great day. Moving on. Oh, sorry. We need to receive the report too. So can I have a motion to receive the report? Councillor Yeo and Councillor Perry. All in favor? And that's passed. So we'll now go to 6.2, which is Customer Experience Strategy Update Presentation. And we have Mr. Brandon Clarkson with us. And whenever you're ready, go ahead. Thank you very much, folks, for coming this morning. Have a good day.
Good morning. Through you, Mr. Mayor. Good morning to everyone, members of council, colleagues, and members of the public. I'm pleased to present an update on the city's customer experience strategy today, which focuses on modernizing service expectations, ensuring a more structured, measurable approach to customer service. This presentation supports Report CS 2025-003, outlining the strategic direction for enhancing accessibility, accountability, and responsiveness in customer service. Let's see if this little doohickey works for me. There we go. So today we'll cover the background and development of the customer experience strategy. We're going to look at an overview of the customer experience strategy supporting pillars. We're going to look at key updates to the corporate customer service standards that have been revised for 2025. And we're going to look at the implementation roadmap for these initiatives. Our objective is to establish consistent, measurable, and transparent service expectations for residents, businesses, and visitors, as well as staff within the city. Today, you're going to hear me use terms such as CES and CSS. So when I say that, the CES refers to the customer experience strategy, while the CSS refers to the corporate customer service standards. So a little bit of background on how we got to where we are today. On February 6, 2024, the Committee of the Whole received Report CS 2024-001, which marked the initial development of the city's customer experience strategy. The early approach to the customer experience strategy focused on broad goals emphasizing accessibility, transparency, and engagement in customer service. Through further analysis and refinement, the city has shifted towards a more structured model, ensuring clear governance, accountability, and service expectations. The CES is now built on 3 key components: the Customer Experience Commitment Council policy, establishing a high-level commitment to service excellence; the Customer Experience Strategy, providing a structured approach to customer service improvements; and supporting directives, ensuring operational alignment and accountability across all city divisions. The city recognized early on that a structured approach to customer service was necessary to ensure high-quality experience for customers. As a result, the 2016 to 2019 strategic plan prioritized the development of the customer service standards. The customer service standards framework was introduced in 2016, setting expectations for service consistency, accessibility, and efficiency. In January of 2017, Report CS 2017-002 formally introduced the corporate customer service standards, and by 2018, the standards were implemented to guide all departments in providing professional, reliable customer service interactions. Since their implementation, the customer service standards has not undergone a formal review. With evolving service expectations and operational changes, it was necessary to modernize them. This revision builds upon the original 2017 version of the Corporate Customer Service Standard, but broadens its scope to incorporate the customer experience strategy, ensuring long-term improvements in customer service delivery. The customer experience strategy was shaped by internal review and stakeholder engagement, identifying service gaps and opportunities for enhancement. The goal is to create a customer service approach that is responsive, transparent, and aligned with best practices. So here's a high-level overview of the new proposed customer experience framework. So the customer experience strategy builds upon the CSS foundation and introduces a structured governance model for customer service. The framework, as you can see on this slide, consists of three primary components and additional directives that support the corporate customer service standard as well. So at the high level, we have the customer experience commitment council policy. We then have our customer experience strategy. And within the customer experience strategy, we have a number of pillars or supporting directives. So we have the corporate customer service standards, which we're presenting today, customer service toolkits, the customer conduct management directive, as well as the corporate complaints handling council policy. And then underneath the corporate customer service standard, we have division service targets. So I'm going to go through in the next couple of slides explaining what each of these are. So the customer experience commitment policy is currently in development, and the policy will establish the city's overarching commitment to providing high quality, accessible, and transparent service to all residents. It will serve as the guiding principle for all customer service initiatives and aligns with the city's strategic priorities. And the policy will ensure a structured approach to customer interactions, reinforcing accountability and continuous improvement. The next layer is the customer experience strategy, which is also currently in development. This strategy will define how the city will enhance service interactions by embedding a customer-centric principles into our operations. The key objectives include establishing clear service expectations across all divisions, leveraging customer feedback to drive improvements, strengthening governance, accountability, and operational efficiencies, and utilizing technology to modernize and streamline service delivery. The supporting pillars now we'll discuss of the customer experience strategy, the first being the corporate customer service standard. So these standards provide a clear framework for customer interactions, ensuring consistency and efficiency. They include defined response times, expectations for inquiries and service requests that come into the city. They introduce a standardized escalation pathway for unresolved inquiries or service requests. And they start to look at performance tracking to measure service effectiveness and responsiveness. Another pillar of the strategy is the customer service toolkits. Some of this information was originally contained within the 2017 version of the corporate customer service standard, and we've moved these into our own separate directive. So these toolkits provide staff with the necessary tools and guidelines to ensure professional, consistent, and high-quality service. They will include standardized templates for service request handling, protocols, and training resources, including things like voicemail scripts, out-of-office message consistency through Outlook, that sort of thing. The next piece is the Customer Conduct Management Directive. So this directive establishes guidelines for respectful and professional interactions between staff and the public. It defines the process for managing unreasonable customer behavior and establishes a structured approach to identifying, documenting, and addressing inappropriate conduct. The next piece is our Corporate Complaints Handling Council policy. And this directive ensures that complaints that are received by the city are handled consistently, fairly, and transparently. They provide clear timelines for acknowledgement and resolution of complaints. So we're going to start moving into now the development of the 2025 version of the Corporate Customer Service Standards. So the rationale for the update. So the 2025 update to the Corporate Customer Service Standards ensures alignment with evolving municipal service expectations and addressing the changing needs of customers. This revision enhances operational efficiencies by establishing a governance framework that strengthens transparency and oversight of customer interactions for the city. Key updates include clearly defined service expectations across all city divisions, improve escalation pathways to ensure timely resolution of service requests, a structured approach to measuring and benchmarking service performance, and a central focus of this update is enhancing accessibility, responsiveness, and proactive communication with customers to ensure that services remain efficient and that they're customer focused. So how did we begin this work? So a cross-departmental working group was established to guide the corporate customer service standard update. And this working group had representation from all city departments, some with multiple divisions participating. This group conducted a comprehensive assessment of the existing service standards, identifying areas for improvement in responsiveness to customer inquiries, accessibility of city services, and operational efficiencies across divisions. Based on the assessment, the corporate customer service framework was modernized, incorporating specialized directives to allow for ongoing updates as service expectations evolve, as I spoke about briefly previously. So the update to the corporate customer service standard was necessary to modernize services expectations and ensure alignment with the broader customer experience strategy. The revision built upon the 2017 version of the corporate customer service standard by integrating feedback from operational staff, best practices, and organizational realities. The Corporate Customer Service Standards Working Group played a key role in evaluating service gaps and inefficiencies, identifying key areas for improvements, and ensuring the updates standards create consistency and response times that are transparent with customers across all divisions. So some highlights of new areas of the corporate customer service standard. So we see the development of division service targets, allowing service flexibility across divisions while maintaining consistency and transparency with customers. We see clear escalation pathways being developed, ensuring we have a defined process and timeline for unresolved service requests. We see standardized response times, so establishing transparent expectations for customer interactions and service completion. We see stakeholder-driven refinements, integrating feedback from all city departments and the public to keep standards relevant and actionable. These updates ensure that service delivery is both adaptable and efficient, and that's really supporting our customer-first approach. So this is the implementation roadmap on how we start to implement some of these initiatives that we've been discussing. So it will follow a phased approach to ensure a smooth transition across the city. Starting in Q1 of 2025, we're going to roll out the updated 2025 corporate customer service standards, and then we're going to begin the work of developing the customer service toolkits to provide staff with the structured resources that we've discussed. Moving into Q2 to Q4 of 2025, we're going to revise the customer conduct management directive. We're going to update the corporate complaints handling policy. And then we're going to start the work on conducting a comprehensive review of our current CRM system to identify areas of improvement. By Q1 of 2026, we want to establish the Customer Experience Commitment Council policy as the overarching governance model for service excellence. We want to finalize and implement the division service targets to create clear benchmarks for service delivery. And we want to fully integrate the CES principles citywide, ensuring a consistent approach to service interactions. So you heard me briefly mention some work that we're going to be completing this year in terms of review of our customer relationship management system, which is JDE CASE. Several challenges were identified with the city's CRM in the CSS review process with staff. Some of the feedback that we heard was limited adoption of of the CRM across departments, inefficient tracking and resolution of customer service requests with our current system, and that there is a real lack of real-time data and insights for performance improvements that are able to be extracted from that system. So starting in Q2 of this year, I'll be doing some work to assess system limitations and department needs to enhance service tracking, identify areas where usability and response times can be improved, potentially with a new system, and looking at better integration between a CRM platform and other service platforms that divisions use to ensure seamless customer interactions. Following that review, a proposal will be developed for the city's 2026 budget to either enhance or replace the current CRM system to improve functionality. And that wraps up the journey of the customer experience strategy and how we've completed the work today. I'm open to any questions that folks may have. Thank you.
Thank you. Let's get a motion to receive the presentation first. Deputy Mayor McDonald, Councillor Joyce, and questions. Deputy Mayor McDonald.
Thank you, through you, Mr. Mayor. Just for some information, I was involved last year with and Councillor Richardson was involved the year before, and we've definitely seen the needle move for sure. And I will continue this year to work with all departments and staff to help with this process. Got a couple of questions here. Is that in Appendix A, you know, we talk about standardized work and with all divisions, and my question is, will JDE, will it actually work for customer service and give us all the feedback that we need?
Through you, Mr. Mayor. Thank you, Councillor, for the question. I'm not an IT expert, but in my honest opinion, I think that if the city really wants to move towards real-time tracking and having true insights and data in our customer relationship management software, there are much better platforms out there that would assist the city in this journey than what JDE is currently able to provide to us.
Okay, thank you for that. And other conversations that, you know, council, we're all told to always make sure we tell our constituents to put in a case number, but there are departments that don't have that ability. So departments are using different software, which is causing efficiencies with handling customer service and requests, and how can we help with that moving forward? When I say that, this is like when we have a complaint and we enter it into the system and a message for the department by phone or email, how do we know what action has been taken, and how is that done, and how do we as councillors find all that information out as far as in between departments that don't have case? And because I've had situations that I tell my customers or my constituents to put in a case number, but unfortunately all departments don't have case numbers, and we're having a hard time finding information. I'm not sure if you've looked into that. I know we're going to have lots of conversations going forward this year, but if you can help me that a little bit with different software.
Through you, Mr. Mayor. Thank you, Councillor, for the question. You're exactly right. So we do experience gaps currently with our CRM system, that it is not used across the entire organization. So when certain service requests come through to customer service and need to be deferred to the appropriate division for action, if that division is not on JDE case, the case is currently closed and then picks up in that division specific software, and it does cause gaps between customers calling in for updates and customer service not having the ability to see the most recent update on that specific service request because that ticket has been closed and transferred into the division system. The hope for the new CRM software that it would be rolled out corporately and that all divisions would use that tool in addition to their specific division tools. So we would see a transfer to a specific division that would maybe indicate a specific reference number for however they track in their divisional system. That way, when a customer called into customer service, we're able to provide them that reference number in whatever division system that it's moved to for handling that service request. That's the goal, to get everyone on one system, and to speak to you folks wanting to come in and get updates on cases. That would allow us to be able to answer those questions more efficiently or direct you to the appropriate division for where that most up-to-date information lives.
I really like to hear that, because I think we're still struggling with departments that have their own silos, and I hope we can find a system that we can bring everybody together. And I think if we have that, I think that would just really help with customer service and so on, and help everybody, the councillors around this table here, to get the answers that we need for our constituents. So thank you very much for your report, and looking forward to working with you for the rest of the year.
Thank you. Councillor Joyce.
Thank you, Mr. Mayor. Through you, if you could switch to slide 17. Great report, by the way. Yeah, I guess when I first read this, right off the bat, I thought, wow, why is it taking a year to come back to these items I've highlighted here to Q1 20? That's a year from now. And I was thinking, well, what are the hurdles? What do is there anything we can do to help you move into this faster? But I sense it's all coming back to the CRM and implementation of a new system. If you can kind of just expand on that, comment on that.
Through you, Mr. Mayor, Councillor, thank you for the question. I think when we specifically look at point 2 around the division service targets, in some cases, this is the first time that we're asking divisions to provide actual benchmarking for how long a service request should take to be fulfilled. And there's a lot of work that's going to need to go into that for folks to be able to analyze their current completion rates of service requests and then look at their capacity to determine what is an actual or accurate number for the length of time that that service request should take to be acknowledged and completed or resolved. So we were mindful that folks are busy right now and that we want to give divisions the time to really look into this so that when these division service targets are created, that they are accurate and transparent for customers. In addition to that, if we're going to give folks that time to develop those division service targets, it made sense to me to then roll out the larger customer experience commitment council policy, as well as the final version of the CES, all at that same time in one final kind of update to you folks, rounding out from today's presentation and the progress that we've made over the next year to kind of finalizing everything we've discussed that we want to achieve today.
Thank you for that. However, the DST expectations would be based on our current system, correct? And if we get a new system that's more efficient, how does that roll into?
Through you, Mr. Mayor, Councillor, thank you for the question. Currently, our CRM software does not track or provide information on how long a service request should take to be completed. So that information isn't available. The goal, obviously not looking at every software that's currently available for a new CRM. The hope is that when a customer would call in or arrive at a service counter asking for a timeline on completion, that these division service targets would be integrated into that CRM, and we would be able to provide a information in terms of how long it should take to be acknowledged and responded to or resolved by the division that it's been assigned to.
Great answer, thank you.
Thank you. Councillor Richard.
Thank you, and through you, just a couple of quick questions, and thank you for the update. It's, like I said, we're moving the needle forward, so it's good to see these. Just when it comes to the one statement about division service targets, is that every division in the city?
Through you, Mr. Mayor, Councillor, thank you for the question. The idea for these division service targets would be for divisions that have service requests that are completed on behalf of residents. So if we have areas of the city that aren't working with public-facing customers, then division service targets wouldn't be created for those. It would be divisions that are public-facing that were receiving service requests for them to do action on behalf of a customer.
Thank you. That clears that up. And just on the revised customer conduct management directive, what is the current challenge with that?
Yeah, so I'm going to defer to CEO Taylor.
Thank you, Mr. Mayor, and through you. So you are seeing a number of moving parts and pieces, and the manager was more focused on the standards as well as the CRM conversation. There was a slide that showed the overall framework, and there are a number of pieces that concurrently, organization-wise, we're putting attention to. So we have to update or create a council-approved policy that commits to customer service fundamentally. So we're working on that concurrently. You're aware that we're reviewing all of your policies over 2025. That's going to be part of that program review. The second council policy that we have but requires update and informs the overall program is the complaints handling policy. So this is getting into the complaint side of things with customers. We have public complaints, we have service or individual complaints. So we're reviewing and we'll be providing recommendations to you on those policies as well. Those are council approved. The next layer is our corporate policies, known as management directives. So the one that we are proposing today is an update to the customer service standards. That is again, a management directive. That's how we do business and do customer service and set those standards internally. So we're providing it to you for information. It'll be approved internally and it will be implemented over 2025. The other that is not existent currently, but certainly has arose as a focus of the corporation, is looking at our interactions with the public, and in particular, customer and staff conduct in those interactions. And we want to provide some corporate guidance on that. We want to empower our employees so that they understand what is appropriate service interactions and what is not, and how to disengage or engage. So we're reviewing that as well this year. That's to say, and I'll go back to Councillor Joyce's original question, it will take us this year to complete all of those component parts, and then I think you'll see a overall exhaustive package that we would be implementing entirely in 2026.
Councillor Perry.
Thanks so much for the presentation and all the work that you're doing in improving standards of customer service, which I know is a big job. I just had a question, and perhaps it's not necessarily in your sphere, but perhaps for the radar, and I've mentioned this to a few of my council colleagues, wondering if there might be a way that councillors, such as in other municipalities, might be able to have direct read-only access to the reported files moving forward. That way we would be able to, when we get an inquiry, look into it ourselves, not change the files, of course, because those are ongoing amid staff, but then be able to report back on status, that way freeing up a lot of work that Constance currently does as a middle person in going back and forth with finding out the exact same information. Again, any comments on that, or perhaps taking it away as food for thought? Thank you.
Through you, Mr. Mayor, Councillor, thank you for the question. What I will say is that some of the CRMs that I've reviewed have different roles for access that can be assigned to specific users that may allow access into specific areas of the system. Obviously, that hasn't been looked at fulsomely, but that's something that I'll take as a desire from council as we're looking forward at a new CRM or enhancements to the current CRM over the next year.
Great.
Or later this year.
That'd be great. Thanks for the consideration. And again, not an occasion or perspective of great, councils are going to be, wading in or mulling about in the files. A read access or read-only permission would simply be, as I said, like other municipalities have, a way of direct information to help with efficiencies, and could be an opportunity to improve what we're talking about this morning, customer service. So thanks very much.
Thank you. We have a motion to receive the presentation. All in favor? And that's done. And can I have a motion to receive the report on customers' experience strategy update, and that the recommendation be brought forward to council for consideration in the next regular council meeting? Councillor Yeo and Councillor Richardson. All in favor? And that's passed. Moving on to 6.3, and it's all about Brandon Clarkson this morning. The 2024 annual update presentation for Customer Service Division. Whenever you're ready.
Thank you, Mr. Mayor. Through you, the chair, good morning again. Yes, lots of face time with me today, but I'm pleased to present the 2024 annual update for the Customer Service Division. This update report supports Report CS 2025-004 and outlines key divisional priorities, achievements, and performance metrics for the division over the past year. So the Customer Service Division is dedicated to delivering high quality, accessible, and efficient service to residents, businesses, and visitors. Council reaffirmed the importance of annual reporting of the division in June of 2023 after a temporary pause during the COVID-19 pandemic. The resumption of annual updates ensures transparency and accountability, reinforcing the city's commitment to service excellence. This presentation will highlight divisional priorities and achievements, performance metrics, and ongoing and future initiatives to improve customer service delivery. So, Customer Service Division operates under a centralized service model designed to provide efficient access to municipal services. Key responsibilities include responding to general municipal inquiries, processing financial transactions, managing service requests, and coordinating with other divisions to facilitate municipal services. Services are provided through multiple channels, including our 4 municipal service centers, the municipal call center, and various online platforms, ensuring flexible and accessible options for customers. So specifically looking at our municipal service centers, the city operates 4 located in Bobcaygeon, Cobeconk, Lindsay, and Omemee. Services provided at these locations include tax and utility payments, licensing and permits, transit passes and waste tags, bulk water sales and documenting commissioning, as well as general inquiries and service requests. Some key updates for 2024 on municipal service centers. So the Cobeconk Service Center reopened in July of 2024, and we see improvements to accessibility and service delivery at that location. As well for this year, as you all have been seeing, the Lindsay Service Center modernization is ongoing here at City Hall, and that project is expected to be completed later this month, again focusing on improved efficiency and accessibility at that location. So moving into our municipal call center, the municipal call center serves as the primary contact point for phone-based inquiries for the city. It plays a critical role in assisting community members in routing calls to appropriate divisions. In 2024, customer service collaborated with the IT division to enhance our call routing efficiency, as well as refinements to the city's interactive voice response system, the menu you use when you call into the city to direct your call. These improvements ensure more inquiries are resolved at a first point of contact and seeing a reduced number of call transfers to inappropriate divisions for improved response times to inquiries or service requests. So online services. So the city provides a range of online services to help customers conduct business efficiently. Available tools include our Report It tool, which allows residents to submit service requests and inquiries to the city. We also see the ability for residents to complete online transactions for curbside collection materials, animal tag registrations, as well as fire permits and road operation permits. Customer service staff assist residents with these digital portals when they arrive at customer service municipal service centers for things like their permit applications or when they're trying to navigate these online services. So building upon that, we have public access kiosks at some of our service centers, which were identified as a key tool for customers requiring assistance with online municipal services if maybe they don't have the ability to access online services from home. So a functionality review was completed in collaboration with IT, and it highlighted the need for improvements to our current kiosk model. I'm excited to say that we are looking at a redesigned public access kiosk model that's going to be piloted here in Lindsay beginning in April 2025. And these improvements will enhance usability and accessibility, improve the overall customer experience, and it's also going to ensure equitable access to digital municipal services for all residents. So moving into service request management, the Customer Service Division plays a key role in ensuring service requests are logged, assigned, and tracked across city divisions. The JDE case management system is used to track requests for road operations, parks and recreation, engineering, solid waste, and water and wastewater services. Customer service directs requests to the appropriate division and provides status updates and follow-ups to customers. As we spoke in my previous presentation, not every division of the city uses JDE case, so we support those divisions and whatever their preferred method of communication is for getting those service requests or inquiries over to them. So as part of the customer experience strategy that we just spoke about and the corporate customer service standards, the city is prioritizing improvements in service request management. Enhancements focus on improved tracking and reporting, aligning divisional systems for better coordination, strengthening partnerships between customer service and operational divisions. And these enhancements will make improvements to faster response times, better transparency, and greater accountability for the city, which is a great move. Speaking of division service targets, the customer service division has established service targets to improve performance, measurement, and accountability within our division. These targets focus on efficiency and responsiveness across our service channels, call handling performance at the call center, and trends in service requests and transaction processing at our service centers. It's important to note that targets will be evaluated over time to align with best practices, but also evolving service expectations from our customers. So this slide's a little loaded, but these are our call performance metrics that we currently have established for our municipal call center. So we have our answer rate, which measures the percentage of total incoming calls that are successfully answered. And our target for this is that 95% of calls are answered that come into customer service. Our service level tracks the percentage of calls that are answered within 30 seconds, with a target that 80% of calls are answered within 30 seconds. The average speed of answer measures the average time in seconds a caller waits before being connected to a representative. That's a target of 20 seconds. And then we also track the average call length. So that represents the typical duration of a call displayed in minutes and seconds. And it provides some insight to us in terms of call handling times, but also call complexity that may be happening at certain times of the year. So for 2024, the call center handled 51,886 calls for the year. We answered 99% of calls that came in. 89% of those calls were answered within 30 seconds from the time the call was initiated. And our average speed of answer was 14.5 seconds before they were actually able to speak with a member of our team. And the average call length was 2 minutes and 21 seconds that they spoke with a customer service representative. It's important to note that there could be additional call time when that potential call was transferred to another city division. So the next few slides are going to cover some graphs and charts for you folks to kind of help visualize that data a little bit. So this slide shows the number of calls received by month in 2024 and kind of shows the ebbs and flows of call volumes throughout the year. The next slide shows the number of calls answered versus not answered by month in 2024. As you can see, we do a great job in answering most of the calls that come into the city. It's also important to note on this slide that our current phone system allows the opportunity, if someone does not want to continue to wait in queue, that they can select a option on the phone system to directly be transferred to our voicemail to have a call followed up on, and those call numbers of not answered show when residents make that decision. The next slide looks at our answer rate. So again, our target is 95% of calls answered, and this shows our percentage of calls answered over all months for 2024. This slide shows our service level. So the percentage of calls that are answered within 30 seconds. So our target is 80%, and you can see the percentages for each month of the year for how quickly those calls were answered. And then our average speed of answer in seconds. So this shows our benchmark, our target is 20 seconds. And you can see here that we met that in all months except April and May. But throughout the latter part of last year, we see significant improvements in the speed of answers that have been occurring in our call center. And then this provides a breakdown of the average call length over each month of 2024. Next, we're going to move into performance metrics specifically related to transactions that occur at service centers. So in 2024, we had 17,417 transactions processed at a service center, and the bulleted list there shows what those payments were in regards to. On the right-hand side, we see a breakdown of the number of transactions by transaction type. So for utility billing, we saw 2,249 transactions. For property taxes, we saw 7,517. And for miscellaneous sales, we saw 7,651 transactions. The next slide refers to performance metrics in terms of service request handling. So total service requests that were received in 2024 were 8,476 for the divisions that are listed on this slide. It also provides the last 2 years, previous to 2024, to see how we've kind of ebbed and flowed in terms of service request handling in the city. So this next slide just kind of focuses on what customer service is going to prioritize for 2025. So I've touched on a few of these, but the self-service kiosk expansion, so continuing our collaboration with IT to enhance self-service kiosks, beginning with the pilot in Lindsay, but the goal is to roll those out across all service centers. The next is looking at our customer relationship management system and completing that system evaluation, working with our divisions to determine what enhancements or needs are to our current system or to a replacement system. And this will be brought forward as a recommendation for the 2026 city budget. The next section speaks to process improvement and standardization. So finalizing Prime BPM process mapping for the division that we've been doing in collaboration with strategy and innovation. So we're finding our standard operating procedures to optimize process and improve efficiency for the division. So thank you to Brenda Stonehouse for her assistance with that. The corporate customer service standards and customer experience strategy, as we spoke to in my previous presentation, but customer service doing the work to implement those standards across the corporation and starting the work on the development of the toolkits and some of the other initiatives identified in the roadmap to implementation. Another key area for us is enhancing data collection and tracking key performance indicators within the division. So looking again at our call center data, service request trends, transaction data, and starting to once again actually count in-person service counts of how many individuals are coming into our municipal service centers. So that goal is to strengthen accuracy in data for the division, but improve performance measures, and that will allow us to make continuous improvement by having reliable and accurate data. We're also looking at expanding our service channels. So in conjunction with the launch of the city's new website later this year, customer service will also be rolling out an online chat system on the website. So residents who want to use that platform to reach out to customer service and have an inquiry answered will be able to do so in an efficient manner, which is exciting. And then the last piece will actually getting us opened and operational in our new Lindsay Service Center, hopefully later this month. That's it for that presentation, and I welcome any questions. Thank you.
Thank you. Let's get a motion to receive this presentation. Councillor Perry, seconder, Councillor Warren. Questions, Councillor Perry?
Just very briefly, and thanks so much for the great reporting. I know you had talked a lot about calls being received and the pickup rate for calls. I was looking at the report as well. Are you able to speak a little bit to, I'm getting some feedback on the microphone here. Is that you, Mayor? It's okay. We'll continue. Were you able to speak a little bit about what I hear mostly is calls not being returned in a timely manner?
Through you, Mr. Mayor, to the councillor's question, thank you. Unfortunately, I don't have data to support that. I think that we would maybe need to look at that divisionally if there are feedback you're hearing that maybe certain divisions or certain service requests aren't being responded to by the city, and specifically working with the directors around the table today to help you understand maybe why those calls aren't being returned. Maybe it's a business process for them or comes down to capacity. I'm not sure. I can't speak to that.
Thanks very much. Perhaps it is departmental. Do you know, do departments keep track of call return times as a performance metric? Because I know as councillor, it's one of my most encountered concerns by residents. You know, my call hasn't been returned. I've called and no one's get back to me. I've left 3 messages, and then it proceeds to the councillor becoming kind of a call service intervener or rep, rather than the traditional work of councillors. So yeah, I would put that question to you if it is departmentally tracked, and how might that be able to be brought into customer service tracking if required, because this is a legacy issue and shouldn't be anything new to anyone tracking customers.
You're good? Okay. Councillor Joyce.
Thank you, Mr. Mayor. And through you, just one question. I love the idea of kiosks, and I'm by no means any expert, but if I walk into City Hall and I have an option of a kiosk to my right or the live person at the desk in front of me, I'm going right past the kiosk. I'm just wondering if a better test might be, I don't know, at the Bob Cajun Library, but I leave that to you and just a comment.
Through you, Mr. Mayor, Councillor, thank you for the question. I think, yes, like my preference as well, someone coming in person, I would love to speak with a customer experience representative. For example, though, there may be times where that line is long and they want to pivot to an online option to conduct their business. The other piece is that there's certain applications or permit processes within the city that require those permits to be completed online. There isn't an in-person option available for those. So having those kiosks available when someone comes in expecting that in-person service, we have the ability to still help them instead of just turning them away and telling them that they need to do it at home, for example.
Very interesting. I would just say that due to our excellent customer service at the front desk, I've never seen a long line.
Okay, thank you. I have a question. I guess it's maybe a follow-up from David Webb's deputation this morning. Is there anything in the system to trigger, or can there be anything in the system to trigger, if we have a case open for several months that, you know, after a month or 5 weeks or something, it lights up or it calls itself to attention so that somebody can follow up on it and get back to the person?
Through you, Mr. Mayor, thank you for the question. Currently, JDE case does not have that capability, so that would need to be manually tracked by divisions or by customer service. However, I think that is a great lead-in to my excitement about exploring opportunities for a revised CRM software that does potentially have those capabilities, that if we have defined service targets from divisions and that service target has been surpassed, that it would automatically bring that priority or notify the assigned division that, hey, you've reached the threshold, this needs to be revisited, instead of it being manually done by staff and having to go through and manually track. From what I've seen out there, that capability does exist. So hopefully that's something that we'll maybe be able to move forward with if that's the decision of the city.
Yeah, and just one other thing on that, when he was speaking about potholes, and we know we have a maintenance standard on potholes, so I'm seeing Director Robinson nod over there that you know, 28 or 29 days is probably in some instances the appropriate time. So good to get that out there, but of course, if we can do them quicker, I'm sure they will. In any event, we have, Councillor Warren, go ahead.
Yeah, thank you. Just on that, through you, Mr. Mayor. Previously, when we had issue track, when an issue wasn't being dealt with, it would go up to, like, from supervisor, you know, maybe to director or whatever, manager to director. So I guess that's in the same vein. Does that happen now? I might have missed that in your presentation.
Through you, Mr. Mayor, Councillor, thank you for the question. No, our current CRM JDE case does not have that functionality.
Well, yeah. So I guess what we had before, it was actually better because it went up to, you know, and was flagged. So I look forward to a better reporting system. Thanks.
Thank you. As I said, we have a motion to receive. All in favor? And that's passed. And can I also get a motion that the strategic plan annual report be received and that the recommendation be brought forward to council for consideration at the next regular council meeting? Deputy Mayor McDonald, Councillor Yeo, all in favor? Thank you. That's passed. Thank you, Brandon. Ms. Stonehouse, you only have 1 minute, so you know, standing in front of people here between them and lunch is, do you want to go ahead with your presentation? And okay. So lunch will be cut back, folks. Go ahead whenever you're ready.
Thank you. Of course, you always give me the best spots, right? So a year ago, Council approved a new 4-year strategic plan, and I'm pleased today to be here to update you on the progress that was made on this plan in 2024. So in the plan, you established a vision of thriving and growing communities within a healthy and natural environment, which is supported by our mission of working together to deliver the highest standard of municipal service and uphold our commitment towards a sustainable future for all. There are 4 strategic priorities: a healthy environment, an exceptional quality of life, a vibrant and growing economy, and good government. Under these priorities, you established 12 goals and 49 actions. In 2024, the senior management team identified some corporate priorities and championed focused efforts to move these forward throughout the year. These are meeting the targets outlined in the Municipal Housing Pledge, improving the customer experience by leveraging digital transformation, and through long-term financial planning, ensuring affordable and sustainable service delivery, and ensuring our municipal assets are well maintained and well managed. So an update on these: the Municipal Housing Pledge, the province assigned us a housing target of 6,500 new housing units by 2031, with a target in 2024 of 542 units. So according to the Ontario Housing Tracker, at the end of October, we had 332 units. There's also another 178 building permits issued. However, the province counts units where the building permit is issued, plus the foundation dug, plus confirmed by the Ministry of Municipal Affairs and Housing. So we're looking forward to seeing this provincial tracker updated to the end of December. But we are well on our way to meeting the target through proactive work by a number of departments to encourage building in our community. Customer experience and digital transformation, well, Brandon just told you all about that, so you can see all that great work that happened last year that's going to continue. And then on the long-term financial plan, updating that, plus the asset management plans for both state of good repair and expansionary items, along with a review of master plans and the development of a master plan framework, updated building and condition assessments, and development of a salary management plan that will allow us to be more accurate in our long-term financial plan. So a lot of foundational work being done. So in your report, you have a full report card of 162 initiatives that were undertaken in 2024 in support of your goals and actions. 73% of those are in progress or completed, and 20% are ongoing. And I'd just like to take you through and give you some highlights. So under a healthy environment, the first goal of supporting environmental sustainability and resilience in our community, we very thankfully onboarded a planning officer of environmental policy and submitted a grant application for the climate change strategy. You approved the active transportation master plan. Our emergency management group completed a community risk assessment to identify potential areas of risk, and we continued exploration of alternate fuel sources for our fleet. The goal of protecting and preserving natural areas, including green spaces, waterways, parks, trails, and farmlands, did our re-accreditation of full scope on-site audit for our drinking water quality management standards. You approved bylaw amendments to support pollinator habitat and approved the tree protection bylaws. And we also doing implementation of lake management plans with our partners at Kawartha Conservation. Increased waste diversion and resource recovery, a lot of work happening on that with increased and expanded landfill diversion programs, including mattresses, construction and demolition waste, and the textile recycling program, which is very popular. Developed the source separated organics program that rolled out this January in 4 urban centers, and managed the transition to producer responsibility for recycling. So under an exceptional quality of life, we talked about the housing pledge. Also commenced construction of 30 new homes at 106 Murray Street in Fenland Falls, and completed the construction of 46 new homes on Hamilton Street in Lindsay. So some great affordable housing units being created. Improving the health and well-being of residents, you invested in primary care services, including after-hours clinics, and approved the funding of the Vital Signs program, which will measure the health and well-being of our community. Parks and Recreation worked on the development of a strategic plan to help develop or determine growth-related capital needs. Under ensuring a range of programs, services, and supports are available and accessible to those in need, there's the establishment of the Social Sustainability Fund, the approval of a new social services plan, creation of 104 new licensed childcare spaces, the development of an interdepartmental encampment response protocol, the expansion of emergency shelter capacity from 19 beds to 30, and the expanded community paramedics program and the dedicated offload nurse program, which you heard about this morning. Under a vibrant and growing economy, building those economic development initiatives to support and expand existing businesses, attract new businesses, and expand our local employment opportunities, very successfully hosted the International Plowing Match and Rural Expo, and we had over 51,000 visitors visit our showcase, Kawartha Lakes. You approved the updated and refreshed economic development strategy, the Cultural Center feasibility study, and you gave that the green light to move ahead to phase 3. And we received $80,000 in funding for the Kawartha Local Food Wholesale Project to ensure greater availability of local food. In encouraging sustainable growth and development, consolidated 14 former bylaws into the Consolidated Rural Zoning Bylaw. The secondary plans for all urban settlement areas are in force and effect. You just recently approved the growth management strategy and the supporting servicing and transportation master plans. And we're continuing the development concierge program, which assists businesses in navigating the development process. In improving and expanding critical and transformational infrastructure, we replaced the Rainbow Bridge across the Scugog River in Lindsay, completed capital upgrades at the airport, updated the transit master plan, implemented the new Orange route, and also extended operating hours. Initiated a fiber optic infrastructure project, and substantially completed the design of the new paramedic service headquarters and fleet center. And then under good government, in providing innovative and efficient service delivery for better customer experiences, we implemented online permit portals for fire service and public works, modernized the Coboconk and Lindsay service centers, established a Coboconk building and septic division hub, completed modernization reviews in public works, engineering, and finance, developed and implemented standard process mapping and documentation, and of course, established service measures as part of the Deputy Mayor's Customer Service Initiative. To provide accountable government and responsible management of resources, the water meter replacement program has been completed in Bobcaygeon and Fenland Falls and is progressing in Lindsay. Completed a digitization strategy, municipal art collection policy, and Replevin report and plan. Review and amendment of the entrance bylaw, and the paramedic service patient experience survey. And then in building a collaborative, supportive, inclusive, and equitable community, you approved the corporate communication strategy, the accessibility master plan, the facility accessibility design standards, and the information and communication accessible design standards, and established MOUs and partnership agreements to support municipal and community efforts. One of those partnership agreements is with the Kawartha Lakes Community Foundation and Kawartha Lakes Community Cooperative for the Vital Signs program. And this program is going to use local data and knowledge to give us a report on the health and well-being of our entire community. And the results of those reports will help us direct investments where they can have the greatest benefit. You can expect to see the first Vital Signs report in Q1 of 2026. Work has already begun on this. Some community conversations have already occurred, and the data is starting to be compiled to start pulling that together for this report. So we made significant progress on many areas in the strategic plan in the first year of it. The senior management team is establishing corporate priorities for the 2025, and work plans for all divisions are being aligned with the strategic plan. And we continue to identify relevant measures so that we can effectively track our progress and report important information to you and to our community. Are there any questions?
Thank you. I got a motion to receive the presentation by Ms. Stonehouse. Councillor Richardson, Councillor Joyce. Questions? Seeing none. Oh, Councillor Warren.
Through you, Mr. Mayor, just a comment quickly, and everybody wants to rush away, that not all the tree bylaws are finished. So, just to let you know that. Thank you.
Thank you. Councillor Joyce.
Thank you, Mr. Mayor. Not a question. I just want to say a very well done report, and thank you. It's you know, you get into the minutia of things, and this sort of shows you, wow, we do a lot. So very impressive, and I'm really looking forward. When I was at Roma 2 years ago, I had a little demonstration of vital signs. So I'm very excited to see that. I think it's a great move. Thank you.
Thank you. Councillor Perry.
Briefly as well, Mayor, I really can't wait to review the Replevin report to which you mentioned. Yeah, it should be a very interesting, fascinating read. I want to thank you, of course, for the presentation. And just a question, because I remember when this was passed last year, we were very much looking at council's role, you know, reporting back, accountability. So thank you for the report today. I was just wondering, with the status of the action plans that were, you know, that are operating beneath this level at the departmental level, are those coming to council as well? And if so, when might those be expected?
I think I will refer that to the CAO.
You may need to clarify for me. I mean, in terms of a general sort of response, this is highlighting sort of what we've taken internally and created action plans to deliver on in terms of the priorities. So the reporting is actually in the report, more specific to the 146, I think it was, initiatives, or 42. It will highlight in more detail what those deliverables were. In terms of developing specific action plans with council, those are more sort of in that master plan work, some of those other strategies that you are consistently approving, and then we will action them sort of in the respective departments.
Thanks for that. Yeah, not necessarily with council, but to be seen by or to be transparently shown or reported to council. I'm just looking at the last page of the action of the strategic plan itself, because council was very alive to this issue, from what I recall, to the discussions around it passing, and it talks about how, in alignment with the strategic plan, which we just heard about, annual action plans will be developed across strategic priority areas and include specific measures and targets. So I'm just wondering what the status of those action plans, and you know, how council would be engaged to be able to provide that public transparency, if you will. Thank you.
Okay, Councillor Richardson.
Thank you, and through you.
Sorry, I didn't get an answer to my question. Sorry, there was a question in there.
So through you, Mr. Mayor, so what we are doing right now is looking at developing action plans, work plans. I guess I'll maybe say generic, and why I was confused to some extent, within all of the departments. Manager Stonehouse also mentioned that we're also extending that action planning and prioritization to a sort of more corporate senior management level as well. So we will be finalizing priorities with actions for 2025. All of the departments are going through the goal setting and goals and objectives and work planning right now. So by the end of Q1, we would have those. We'll look for a mechanism. It sounds like what you're looking for is, how do we share those en masse? You can appreciate there are hundreds of work plans, but having said that, I think we can find a way to best share them and make sure that council is aware of what's happening in year.
There it is. Thank you.
Thank you, and through you, Mayor. Yeah, just along the same lines as we appreciate looking at how much work we actually did accomplish in 2024. It's pretty impressive. So thanks for that. And also, when we're looking at the new vital signs, it's really just a tool for us to measure how we're moving through our strategic plan. Is that correct?
Through you, Mr. Mayor, to the councillor. So vital signs is a little broader than our strategic plan, but it does hit a lot of the progress indicators that we have established for the strategic plan. It's looking at the overall health and vitality of our entire community. And it's really getting to those quality of life measurements, both qualitative and quantitative. So we're going to be looking at actual data from a number of sources, as well as having community conversations to hear from people in the community to better understand where things are at. So it really is in alignment not only with the strategic plan measures, but also the community safety and well-being plan.
So even more good news there. So thank you.
You're welcome. We have a motion to receive the presentation. All in favor? And that passes. And we have the strategic plan annual report to be received and forwarded to council for consideration. I have a mover and seconder for that. Deputy Mayor McDonald, Councillor Perry. All in favor? And that passes. Thank you. Thank you, Ms. Stonehouse. We're now going to break for lunch, and we'll come back at 1 o'clock. Lunch is, for those in attendance, lunch is served upstairs in the Weldon room.